Hi guys, this is the assessment item video for assessment item 3. So in this one I'm just going to briefly talk to you about the safe practice assessment. So this assessment tends to get people more anxious than it really needs to. The purpose of this assessment is to make sure that you're practicing safely, not expertly. So the two things that we're going to show you in labs fairly often, we're going to do it quite a lot, and the process that we're putting you through involves you demonstrating the skill to a level of safety and competency rather than being expert at it, as I said. So try not to panic. We've got a video that I've put together where I demonstrate the skill that will be involved in the SPA, and I've done it once all the way through from start to finish, and then I've done it 5 different ways to show you the levels of competency in one of those particular moments. So I've showed you the different levels of competency. I'll show you that in a moment. But this is a satisfactory, unsatisfactory item, so similar to assessment item 1, if you fail this assessment item, you'll fail the subject. So you need to get through it in one of the attempts. It has a variable due date because this is performed in class, so for on-campus students this will be done in the last 3 weeks of class in your labs. If you're an online student, you'll do this in the last day of res school. So there's no return date because that's not applicable, and there's no submission because you'll be doing this assessment in the class setting. So this assessment task requires you to complete the following nursing cares in a simulated patient encounter, including employing a range of assessment techniques to systematically collect relevant and accurate information and data to inform practice, including collecting a patient's vital signs, collecting and documenting a person's vital signs, and collecting and documenting a person's health history. So you'll be doing a set of vital signs and collecting the health history of the person. Now both of those things have charts that are in the lab manual that you're able to look at well and truly before the assessment, and we'll be practicing those skills in class, as I mentioned. You also need to seek informed consent prior to any nursing care provided, so you can't touch the other person without asking them first. You need to apply appropriate infection prevention and control practices, so washing your hands thoroughly and wiping down your equipment. And you also need to demonstrate professional and therapeutic interaction in clinical practice. So you need to be taking it seriously. You need to I've not seen a student not take this seriously, but if you're being silly, if you're breaking out of the simulation and sort of having sort of unprofessional chat with the person or something like that, that would be a fail for the assessment item as well. You need to walk in and treat it like it's a workplace learning placement and you're there with a real patient. The assessment is completed in the clinical lab sessions, as I mentioned. For online students, this is done at res school. For on-campus students, it's completed later in the session in the on-campus clinical lab sessions. One of your peers will act as the patient in the scenario. This encounter will be observed by an academic assessor. You'll have permitted 2 attempts to complete the assessment. So to pass the assessment, you must meet the level of assisted, supervised, or independent for all criteria. And I'll show you the criteria in just a minute. If you're marked as marginal or dependent in any element on both attempts, you'll be given an unsatisfactory grade for this assessment item. So I'll show you that in the rubric, but basically there's 5 levels of competency and you need to be in one of the top 3 levels, and to be even at assisted level, you're still requiring the odd prompt to do the right thing. So at first year level, we're not expecting you to walk in and do this flawlessly. It's going to require a little bit of prompting, but if you need the lecturer to be talking you through every little part of the process, then you haven't really understood the practical application of what you're doing, and we would need you to do the subject again. The assessment task assesses the following learning outcomes. So it looks at collecting an evidence-based health assessment framework to collect vital signs and health history. Also that you're able to document patient assessment in a format which meets legal and organisational standards, and we'll be looking at that in the tutorials. Also to be able to define nursing terminology and use it in the correct context. The assessment also allows the student to demonstrate competency in the practical application of skills and knowledge learned in the subject, and it will ensure that you meet the expectation before you move into NRS112. So this subject is a prerequisite subject for NRS112, which is where you do your first workplace learning placement. So before you move into a subject where you'll need to go out on placement and do these skills, we've picked 2 very straightforward skills that you need to do for us before we move on to the next subject. So the marking rubric is fairly straightforward. You need to assess and document a person's vital signs and the health history to an assisted, supervised or independent level. So to meet a satisfactory for this assessment, you meet all elements of the assessment to an assisted, supervised or independent level. Unsatisfactory is if you're assessed as marginal or dependent in any element despite having 2 attempts at the assessment. And your final grade for this assessment will be satisfactory or unsatisfactory. Now, briefly going through the codes, and this is done in the video as well, so I've demonstrated what each of these looks like. Independent refers to being safe and knowledgeable, proficient and coordinated and appropriately confident and timely, does not require any supporting cues. Now, this is a level of independence that we wouldn't expect you to have in this subject, so if you're getting independent for any of the criteria, you're doing very well. Supervised requires to being safe and knowledgeable, efficient and coordinated, displaying some confidence and undertakes activities within a reasonably timely manner, requires occasional supporting cues, so the odd comment on what you might need to support you. Assisted refers to being safe and knowledgeable most of the time, skillful in parts, however, is inefficient with some skill areas, takes longer than would be expected to complete the task and requires frequent verbal and some physical cues. So if you're scoring at that level, you'll still pass for this subject. Now, as you progress into future subjects, you should expect that the assisted level won't pass as a pass, that'll become, you'll need to get supervised or independent in higher levels. But to start off with, for this assessment item, you can still score assisted and pass. In the marginal section, it refers to being safe when closely supervised and supported but unskilled and inefficient, uses excess energy and takes a prolonged time period, continuous verbal and physical cues. So that means if the nurse wasn't standing there watching every little thing that you did, you wouldn't be able to do the skill at all. And obviously we're not able to pass you and move you forward into the next subject if that's where you're up to. Dependent refers to concerns about being unsafe and being unable to demonstrate behaviour or articulate intention, lacking in confidence, coordination and efficiency. Continuous verbal and physical cues, interventions necessary. So at that level, you're basically unsafe, and if you were doing those sort of activities on placement, you would actually be removed from placement. You wouldn't even get to keep going. So at those levels of support, that's what we'll be assessing you. So we'll have a quick look at the manual, because that's got all the information in it that we need. That's the end of the assessment item in the subject outline, so it's very quick. So if we go up to our home page again, so from the home page you can see that we've got class materials here. And I'll just put that back to student view. And if we scroll down, you've got the tutorial manual there, and we've also got the clinical lab manual. So we'll download that. Now, towards the end of the clinical lab manual, if you look at, scroll through all this stuff, get to the content section of the manual. Towards the end is where the simulations are. So you'll find in the last few weeks, this is where the material is for these weeks, because what happens is we'll be doing the major simulations that we do at the end of session. They'll be happening at the same time as these safe practice assessments. So there'll be, most of your group will be doing the simulation at the time, and then you'll be taken out in small groups. So you won't be doing this in front of large groups of people. You'll be doing it with just a peer, one other student, and the assessor watching you. And this is sort of further information about the assessment in the lab manual. So it explains why we're doing the assessment. It talks you through the task, as I just mentioned. It's got the same codes that I just talked you through, and the rubrics in here as well. And as I mentioned, there's a demonstration that I'll show you in a sec. But this is the health history form that you'll be completing, and again, we'll be practicing this in class before you do this assessment. So that's how you collect the health history, and then there's vital observations chart as well. So you'll need to be able to do each part of the vital observations assessment. This is the assessment form that we'll be using. You can see that at independent or supervised, that's good for all those things, and assisted is the level that you need to meet to pass. In the marginal and dependent sections, if you're getting those for any of these criteria, you won't pass the assessment item. So have a read through that as well, and you can use that when you're practicing in class. Make sure that you're doing everything without needing prompting and stuff. And then I'll quickly show you in the help with assessments page. this video here. So just beneath the presentation that I'm making at the moment, you'll find this video which demonstrates, this is me as the student performing the skill with Krishna watching me, and yeah, so that's available for you to have a look at as well. It's well worth looking at, particularly if you're nervous about it, that you can see the assessment and that there's no tricks involved. It's just going in and doing observations and collecting a health history, but we need to make sure you can do that safely. So this is assessment item 3, which is the safe practice assessment.